Social Security has its share of problems, but could it be a strong model for the delivery of health care benefits in the future? Governor Bredesen is here with me now. He served as governor of Tennessee for 2 terms, and he's just written a book called Fresh Medicine. Welcome.
Right. Thanks.
Well, certainly Social Security has had its share of issues, but you believe that this could be worked out through a new health care delivery system?
Yeah, I mean, Social Security has been around for a long time, and it's a successful program. It is a popular program, even though most Americans pay more in their Social Security taxes than they do in their income taxes. You don't see Tea Party protests to eliminate Social Security. And to me, a social program is built around the idea of a trust fund, a dedicated source of funds for that trust fund, introduces, some real discipline into the process and can work. Now, I know we hear about Social Security problems today, but they're really fake problems. I mean, these are problems the Congress can solve this afternoon if they want to. It's not like health care where it's just much more complicated. All that's happened is the Congress has not been good stewards of the program. They've increased the benefits without increasing the taxes that go along with it, and are now starting to pay the price for that. But it's an easily solved problem, and the underlying mechanism, a trust fund for that, it works good. In fact, I'd say the fact these problems have even come up, they're much less severe than they are in other parts of general government, but they're there and they're obvious because of the trust fund nature of Social Security.
Well, certainly there's the problem that it's going to run out of money. What could we do to help that or avoid that happening in a similar system in the healthcare system?
Well, I think you've got to set the thing up from the beginning with the discipline that it is going to be a trust fund, and you're not going to make general fund contributions to it. You're not going to let it run deficits. If it's running out of money, you need to either increase the taxes or pull back on the benefits in some fashion, and that's what Social Security has to do. I mean, it is not a complicated problem. Anybody that took an actuarial course in college can figure out what to do with Social Security. But as a starting point for a different form of health care, one that's not tied to employers, for example, one that's transparent across whether you're working or not working or at home or in business, I think it's a great starting point. It's proved itself. We used it again for Medicare Part A when the time came along. It's popular, and I'm surprised that we didn't look a lot more carefully at that model in health reform.
Is it coming? I mean, do you think that people will be willing to implement something like this?
Look, I'm a believer that the health reform we have is not going to work. I think there's just too many ways in which it didn't solve any of the big problems and created a few new cost problems of its own down the road. So I think at some point in the future, the President and the Congress are going to have to settle down and figure some very different things to do with it. And I hope that when that happens, that stepping back a bit and not just trying to take the same old program and put a little more money into it, but step back and say, look, we've got Social Security. It's been very successful. What can we learn from that? What can we borrow from a structural program like that to design a healthcare program?
How could it impact the quality of care?
Well, I think one of the important things you have to do is I'm a huge critic of the quality of care in this country. I mean, I think it's good in some areas, not so good in others, very variable depending on where you live and where things are. I mean, one of the things that I proposed in the book is we need a modern, external, independent quality assurance, quality auditing system in healthcare. When Boeing builds an airplane, we don't let every welder do what they want and every riveter do what they want and every electronic designer do what they want. We've got standards. We audit against those standards, and for that you get good, safe airplanes. If we took a small amount of the money that flows through healthcare, 0.5%, 0.25% of healthcare, and set up a really strong independent auditing system, set up some really good standards as to what were acceptable bounds of care, still leave lots of professional discretion, it would transform healthcare.
Okay. Governor Bredesen, thank you very much for your time today. I'm Mabel Jong at the 8th Annual World Healthcare Congress in Washington, D.C.